Well, the state of Indiana is now making some changes to the quarantine rules at schools.
Yeah, and likely if you have students, you've been impacted by the current rules, and what they are right now is require students to quarantine at home if they happen to have close contact. That's when they happen to be within 6 feet of someone who had tested positive, and that exposure was to last 15 minutes or more.
So here's what's going to happen beginning on Monday. The state of Indiana will no longer require contact tracing or students to quarantine if students and teachers stay at least 3 feet apart in the classroom. They must continue to wear a mask at all times like they've been doing.
Quarantine rules will still apply when they're outside of the classroom. You know, for example, when they're on campus, but they happen to be at lunch. Maybe they're in band or choir or outside at recess. Here's the state's top doctor explaining some of the reasoning behind the changes today.
Data from individual schools in the state and across the U.S. indicate that it is rare for student infections to occur from exposure in the classroom when all parties are masked. That data shows only about 3 to 5% of infections occur in classroom.
The state of Indiana is also going to be sending out more than 1 million of those K995 masks, plus more hand sanitizer to schools.
Also, the state plans to air a new COVID commercial. It's going to air during the Super Bowl this Sunday in the middle of the game. And this is a piece that features the son of Paul Logan. You might recall he's the North Central High School athletic director, and he died from COVID early on in the pandemic. Here's a snippet.
When my dad was sick in the hospital, that was the longest 12 days of my life. Just sitting there not knowing each morning if he's alive. I want to tell people, like, this is serious and this vaccine will save people. Tuesday morning.
The governor says this ad cost a little more than $100,000, and he added it was worth every penny. Now, the White House COVID response team says right now, when they look at the numbers, they think they are on track to get 100 million Americans vaccinated in the president's first 100 days in office.
Right now, they're averaging 1.3 million COVID shots every day. They've purchased an additional 200 million doses of the vaccine.
The government also has found a way to get a 6th dose from every Pfizer vial of vaccine as well. And despite this progress, they say they still need help.
We are at war with this virus. It is clearly a national emergency, and we are doing all we can. But it is critical that Congress does its part as well. We need Congress to quickly pass the American Rescue Plan to provide the funding we need to continue to scale up our vaccination program, as well as for more testing, more genomic sequencing, and more emergency supplies.
The COVID response team also addressed what we're seeing now, which is a downward trend of cases. But they made it clear you still should not gather right now in big groups, especially we know it's so tempting because you want to get together with your friends and watch the Super Bowl this Sunday.
Yeah, they don't want the Super Bowl to turn into a super spreader event like we've seen at some events over the holidays.
Yes, it's hard because that is our tradition. We want to let you know about a new study that shows that a single dose of the AstraZeneca vaccine can slow the spread of COVID-19. And this happens to be the first vaccine to have results like that.
The Oxford AstraZeneca researchers also found the first dose was 76% effective at preventing COVID for 3 months. Even more effective after people got the second dose. The FDA is waiting on a clinical trial before authorizing those shots here in the U.S.
And that trial is underway in part here at IU Health. Right now, there's a group of Hoosiers that wants lawmakers to take up a bill that prohibits your employer from requiring you to go get a COVID vaccine.
Yeah, many of the people that we talked to at the Indiana State House today told us they should have a choice when it comes to these vaccinations.
We're speaking out for bodily autonomy and the right to choose what goes into our body and what doesn't. This is a fundamental liberty, and I think people are missing that idea. The individual has the right, I'm a nurse, okay? It's a foundation of medicine, the right to bodily autonomy or to choose what happens to your own body. And so we must preserve and protect that right, because as soon as we start losing those rights, we get on a slippery slope, and who knows what's next.
The group says they're upset because they claim that one of the bill's sponsors is not pushing lawmakers to hear it. The bill is currently stalled right now in a committee, and they'd like it to come before lawmakers for a vote. We'll keep an eye on it.
It appears President Joe Biden and Senate Democrats are now working to pass COVID relief without Republican support.
The president insists that Americans will get $1,400 checks. And he met with Senate Democrats in the Oval Office today as part of an effort to make that happen. The meeting comes after he met with some Republican lawmakers days ago. They wanted to lower the amount of those direct payments and also change who it went to. The White House insists the nearly $2 trillion plan is bipartisan, with 74% of the public supporting it.
We must not repeat the mistakes of the past and do too little, too reluctantly, and too late.
The rushed budget process that will play out this week is exactly the wrong path toward making law.
Now, all Senate Democrats would have to vote together to pass this bill without Republicans.